ThyroSeq is a molecular diagnostic tool that uses the power of innovative technology called next-generation sequencing to allow identification of benign and malignant thyroid nodules. Thyroid nodules are actually common and occur in up to 50% of normal people by age 60. However, thyroid cancer only occurs in 5 to 10% of these nodules. To find the small number of nodules that harbor a cancer, the most useful procedure is fine needle aspiration, or FNA. FNA uses a small needle to aspirate or withdraw cells from a thyroid nodule. The aspirated cells are then placed on glass microscope slides and can be examined by a pathologist to determine whether the nodule is cancer or is benign. The problem is that in up to 30% of cases, the diagnosis cannot be made just by looking at the slides under a microscope. Until recently, indeterminate cases were resolved by doing diagnostic surgery, which involves removing some or all of the thyroid gland, so the entire nodule could be examined. Though diagnostic surgery allows definitive diagnosis, about 80% of the nodules removed by surgery are benign. That means that the majority of patients receive what ultimately proves to be unnecessary surgery. Additionally, since these diagnostic surgeries usually involve conservative removal of only half the thyroid, when cancers are found, a second surgery or completion thyroidectomy is often needed. The power of ThyroSeq is that it allows us to know with very high certainty whether a nodule is likely to be benign or malignant without diagnostic surgery. When the ThyroSeq analysis shows no gene abnormalities, the likelihood of a nodule being cancer is less than 4%, which is as good as having a pathologist identify a nodule as benign by looking at its cells under the microscope. But ThyroSeq also identifies patients with a high likelihood of cancer. For those patients, surgical management is the right thing to do. And because ThyroSeq identifies the genes associated with more aggressive cancers, it also helps us choose the right extent of surgery. So ThyroSeq does more than just find cancer. It can also help us tailor treatment based on the type of tumor that may be present and how likely these cancers are to be aggressive. The ThyroSeq report is easy to follow. The report provides a simple positive or negative result indicating whether mutations associated with cancer are present or absent. When mutations are present, the report lists all genetic alterations and provides the associated cancer risk, allowing the doctor to make the best therapeutic decision possible. The genes included in the ThyroSeq panel were identified by numerous scientific investigations and have been extensively tested and validated at the University of Pittsburgh Medical Center, where ThyroSeq was developed. No test can take the place of good clinical judgment. However, by using ThyroSeq, many unnecessary surgeries can be avoided, and many thyroid cancers that evade detection by the microscope can be found. That allows doctors like me to provide the best possible care to the patients that we treat.